Just recently, I was talking to someone who manages procurement for a mid-sized hospital, and the way they described supply chain honestly sounded very stressful. Not because it's chaotic all the time, but because when something does go wrong, it's never small. It's either stockouts or overstock, or something stuck in approvals. And then you layer compliance on top of that. So when I hear AI-powered medical supply chain, my first reaction isn't excitement, it's, this sounds risky.
That hesitation is actually a good sign, because in healthcare, you're supposed to think that way. The goal isn't to introduce AI for the sake of automation. It's to solve very specific inefficiencies that already exist without creating new risks. In supply chain, those inefficiencies usually show up as lack of visibility. You don't always have a clear, real-time picture of inventory, usage patterns, or incoming demand.
Yeah, and I'm guessing people compensate for that by playing it safe, either over-ordering or double-checking everything.
Exactly, and both of those have a cost. Overstocking ties up capital and increases waste, especially with medical supplies that expire. On the other side, understocking leads to urgent procurement, which is almost always more expensive and disruptive. AI helps by improving how demand is predicted and how inventory decisions are made, but it has to be done in a way that stays compliant.
Okay, let's talk about that part, because HIPAA-compliant AI sounds like one of those phrases people throw around. What actually changes when you say, a system is HIPAA-ready?
It changes how the system is designed from the ground up. In a healthcare supply chain, you're not always dealing directly with patient records, but data can still be connected. Usage patterns, treatment volumes, department-level consumption, all of that can indirectly relate to patient care. So a HIPAA-ready AI platform ensures that any data it processes is handled securely. Access control, encryption, audit trails, everything is built in. At Biz4Group, when we work on these systems, compliance isn't a feature we add later. It's part of how the system is structured from the beginning.
So it's less about making AI compliant and more about building it inside the rules from day one.
Exactly, because retrofitting compliance rarely works well in healthcare.
Let me come back to the business side for a second. If I'm evaluating something like this, I'm not just thinking about risk, I'm also thinking, what improves if I get this right? Where do operators actually see the difference?
The biggest shift is in decision-making. Right now, a lot of supply chain decisions are reactive or based on static thresholds. You reorder when stock hits a certain level or when someone flags a shortage. With AI, you're factoring in patterns, usage trends, seasonal changes, historical data. So instead of reacting late, you're planning ahead more accurately. That reduces emergency purchases, improves inventory turnover, and gives you more control over costs.
So fewer surprises and fewer last-minute decisions.
Indeed. And those last-minute decisions are usually the most expensive ones.
What about implementation, though? Because healthcare systems don't exactly welcome change easily.
That's true, which is why these platforms are usually introduced in phases. You don't replace your entire supply chain system. You integrate AI into specific areas, like demand forecasting or inventory tracking, and expand from there. That way, you're improving outcomes without disrupting core operations.
All right, so if I'm sitting in that operator seat, this isn't about chasing efficiency for the sake of it. It's more about tightening a system where mistakes are already expensive and making sure any improvement doesn't create new risks.
That's exactly the balance.
Yeah, that makes sense. Because in something like healthcare supply chain, getting it slightly wrong is already costly. You don't get much room to experiment casually. But if you're working with Biz4Group LLC, their AI experts will make sure that nothing of that sort happens with your organization.
Thank you so much for having me and letting me share these insights.
Thank you so much, Sanjeev, for all the insights you shared. As for our audience, stay tuned for more.